Hi everyone, this is Dr. Chakraborty. Today we're going to talk about an exciting breakthrough in treating high LDL cholesterol. You've probably heard that high LDL cholesterol is bad for your heart, but did you know scientists have discovered a completely new way to lower it? Let me ask you this. What if your body had a built-in recycling system for removing cholesterol, but something was blocking it? That's exactly what happens with a protein called PCSK9, and the good news, we now have drugs that can stop it. By the end of this video, you'll understand how your cells naturally clear LDL cholesterol from your blood, what goes wrong, and how new medications are saving lives. First, let's talk about LDL cholesterol. It is not cholesterol, rather a carrier which carries cholesterol to different tissues. We often call it bad cholesterol or just LDL. When excess LDL circulates in your bloodstream, it accumulates along the walls of your arteries, similar to how grease builds up inside a pipe. Over time, this buildup can create blockages that restrict blood flow, leading to heart attacks and strokes. So, how does your body normally get rid of LDL? That's where our hero comes in, the LDL receptor, or LDL-R for short. Think of LDL receptors as tiny grabbers on the surface of your liver cells. Their job is simple. Grab LDL cholesterol from your blood and pull it inside the cell to be broken down and recycled. Here's how it works. The LDLR sits on the cell surface waiting. It grabs an LDL particle from the blood. It pulls the LDL inside the cell. The LDL gets broken down. The receptor returns to the surface to grab more. It's like a recycling system that runs 24/7. The more LDL receptors you have, the more cholesterol gets removed from your blood. But here's the problem. Meet PCSK9, a protein made by your liver. PCSK9 is like a saboteur. When PCSK9 binds to an LDL receptor, it marks it for destruction. Instead of recycling LDL, the receptor gets destroyed along with the PCSK9. Fewer receptors mean less LDL removal, which means LDL builds up in your blood. Some people naturally produce too much PCSK9, and that's why they have dangerously high cholesterol even with diet and exercise. So scientists thought, what if we could stop PCSK9? That's where PCSK9 inhibitors come in. These are drugs designed to block PCSK9, and they work in two different ways. The first type uses monoclonal antibodies. These are lab-made proteins that work like guided missiles. Two examples are evolocumab and alirocumab. These antibodies float in your blood and grab onto PCSK9 before it can destroy your LDL receptors. With PCSK9 blocked, your LDL receptors survive and keep removing LDL bad cholesterol. The second approach is even more clever. It uses something called siRNA, that stands for small interfering RNA. The drug inclisiran uses siRNA to stop your liver from making PCSK9 in the first place. It's like stopping the problem at its source. Here's what's amazing. You only need an injection twice a year. The siRNA works at the genetic level inside your liver cells, turning down PCSK9 production for months. So what happens when patients use these medications? Their LDL cholesterol can drop by 50 to 60%. That's a dramatic reduction that significantly lowers their risk of heart attacks and strokes. Let's recap. Your liver cells have LDL receptors that remove bad cholesterol. PCSK9 destroys these receptors. PCSK9 inhibitors block this destruction. Monoclonal antibodies grab PCSK9 in the blood. siRNA stops PCSK9 production at the genetic level. Result, more LDL receptors equals lower cholesterol. This is precision medicine at its best. We understand the molecular problem and have designed specific solutions. Pretty cool, right? Thanks for watching.